Welcome to the press conference for the Johnson County Emergency Operations Center for Tuesday, May 5th. I'm Kelly Andreessen, Public Information Officer for Johnson County. Thank you to those in the media reporting on this, to our community partners who are participating, and for those who are watching online. We are streaming live on City Channel 4's YouTube page and on the Johnson County Public Health Facebook page. We are practicing social distancing, so we have limited the number of people in the room, and for those purposes, we have a few speakers participating via Zoom. And for those who are in person, I will bring in each speaker one at a time. They'll make their statement, and then we will open it up for questions for that person. For reporters, if you have follow-up questions with an individual, please touch base with us after the press conference, and we'll connect you with them. We are taking questions from reporters virtually, so thank you for your patience and your flexibility. And we will get started with Dr. Teresa Brennan, Chief Medical Officer, University of Iowa Hospitals and Clinics. Good afternoon, Dr. Brennan. Can you hear us?
Good afternoon. How are you? Good. Thanks for the opportunity. I wanted to take a moment to just update you on numbers. So as of today, we have 28 adult inpatients hospitalized with us. That makes a total of 139 adults who have been hospitalized with COVID-19 to date at UIHC. We do not have any pediatric patients in-house right now. We have had a total of 4 patients. I think yesterday we reported 5. There was a presumptive positive that actually became negative. So the correct number is 4 to date. I'm happy to take questions.
Thank you, Dr. Brennan. We have a question from Sarah Watson with the Daily Iowan. Gilead's CEO said yesterday that the company had donated enough remdesivir to the U.S. government to treat hundreds of thousands of COVID-19 patients in the U.S. and hopes to get the antiviral drug to patients and doctors as soon as this week. Could you give us an update on UIHC's clinical trial of remdesivir? Would UIHC be ready to administer remdesivir more broadly than on a clinical trial? And do you know if UIHC is receiving remdesivir as part of this program the CEO Daniel O'Day was speaking about?
Thanks, Sarah, for the question. A really good question. So as everyone knows, remdesivir has been approved for use in severe patients with COVID-19. We have participated in the trial, both for the severe arm as well as the moderate disease arm. We are prepared to deliver remdesivir off trial according to the FDA guidelines when it's available. We have not, as of this morning, received any of that allocation.
So, Dr. Brennan, we don't currently have any other questions, but we're going to give it a little bit of time to support our lag that we have in the video.
Y'all are taking it easy on me today.
Apparently. All right, it looks like we don't have any additional questions. Thank you, Dr. Brennan.
Great, have a great day. Thanks so much. Stay safe.
All right, now we have Margaret Reese, Public Information Officer for Mercy, Iowa City. Hello, Margaret.
Hi, Kelly, how are you? I'm well, thank you. So as of 8 a.m. today, we had 9 patients who are positive for COVID-19 in the hospital as inpatients, and 1 was awaiting their test results. This is day 58 of Mercy's COVID-19 response. We began elective surgeries yesterday with orthopedics, urology, and general surgery procedures being performed, and we plan to have endoscopic procedures start up again this week, a little later this week, and cardiovascular surgeries to begin again next week. Urgent and emergent surgeries never stopped being performed, so we are increasing the number of patients being cared for surgically by going back to elective surgeries, being able to resume those again. Surgeries have also begun again in the ASC, or the ambulatory surgery center that we have at Northgate. This process is going very well, and we are able now to do in-house testing prior to surgery, and we get results back within an hour. So this is very, very helpful. The in-office visits at our 25 Mercy primary and specialty care clinics are also beginning to increase, and this is not diminishing the volume of telehealth visits. So it's a positive sign that patients are feeling more confident to reach out to their providers for care. So our volume is increasing in the clinics, which is also very good news. Convalescent plasma therapy is a very promising treatment for patients who are critically ill with COVID-19. We have been able to administer plasma successfully to 3 patients so far, and we encourage anyone who has recovered from or is recovering from COVID-19 to consider donating plasma. More information is available on the Mercy Iowa City website, which is www.mercyiowacity.org. You can click on the Learn More button on the COVID-19 banner at the top of the page. Mercy receives its blood and plasma supply from the Mississippi Valley Regional Blood Center, and the donation would be made to them. At this time, to be eligible, persons must be symptom-free for 28 days, although this length of time may be reduced, but for now it is 28 days. And individuals can register or pre-register online or ask their physicians to register for them. All of the information is on our website at the address I gave. By donating plasma, an individual can save the lives of others who are critically ill. So this is enormously important, and we strongly encourage anyone who has recovered from or is recovering from COVID-19 to consider plasma donation. We also ask everyone who is coming to the hospital or going to a clinic appointment in person to wear a cloth mask. We encourage everyone to continue following precautions by socially distancing, wearing a cloth mask when around others, frequent hand washing and sanitizing frequently used surfaces like phones, keyboards, counters, tables, faucets, steering wheels, and more. As I said, we are seeing increased volume in our clinics, both in person and via telehealth, and want to remind everyone that it is safe to seek medical care, but we strongly encourage that the basic precautions continue to be followed. And also tomorrow is National Nurses Day, and we thank not only our Mercy Iowa City nurses, but all nurses, no matter where they work, whether they're in the hospital, a clinic, a surgery center, public health, hospice, long-term care, assisted living, home health, and more. We thank them for the care they provide, which is more critical now than ever. So happy Nurses Day to all of our nurses in the community and across the state. Thank you.
Thank you, Margaret. We have a few questions from Hillary Ojeda with the Press Citizen. When did the hospital resume elective surgeries? About how many elective surgeries is the hospital doing on a daily basis, and what kinds of elective surgeries is the hospital doing?
We started yesterday, May 4th. We had 9 elective surgeries yesterday and 1 emergency that came in. But we have tested 40 coming up. So we are ramping up slowly. This is a very complicated balancing act to make sure that we are safe, that we have adequate PPE, that we have the staffing, that we have the capacity in beds and the appropriate staffing for those beds, that we have the drugs that we need and so forth. But we are ramping up cautiously, but enthusiastically. And so the number of surgical procedures will probably increase every day. As I said, we had yesterday orthopedics, urology, and general surgery, but we will be beginning the endoscopic procedures and also cardiovascular surgeries next week. And of course, all along, we have been performing surgeries here, whether that is a C-section or whether it's an orthopedic procedure or heart or whatever has been necessary when those procedures, when they have been necessary for emergency reasons. But we started with the electives yesterday. So, so far so good. It's gone extremely well the last 2 days.
All right, another question from Hillary. Has the hospital resumed other temporarily suspended services? And if so, what kinds of services?
I think I probably just answered that with things like endoscopic procedures, those things that require PPE, they require perhaps sedation, that sort of thing. The goal has been for a long while to make sure we had adequate PPE, and through a lot of hard work, many donations, enormous amount of work on behalf of Johnson County Emergency Management and the state, and just a lot of conservation efforts and so forth, we have been able to get into a somewhat more comfortable position with PPE. So we are much more confident in resuming those procedures and surgeries now, that we can balance the needs that we have for surgical procedures as well as for our inpatient needs.
Thank you. Another question from Hillary. Has the hospital seen a peak in COVID-19 cases?
I don't think so. We had a significantly higher volume 2 weeks ago, and now it's back at a more steady level. As I said, we had 9 inpatients today and 1 who was awaiting their test results. We don't know what to anticipate in terms of more of a peak than we have seen so far. We certainly hope that Iowa and Johnson County have been successful in flattening the curve to a healthy degree. So I guess that's what I have to say about that. We really haven't seen anything extraordinary, but 2 weeks ago we did have a real spike that lasted for a few days.
One last question from Hillary. Generally, how is the hospital viewing reopening at this time?
Very positively. We're very grateful to be able to start to get back to our previous workflow and previous volume. That's extremely important for us and for every hospital in the area and certainly across the country. It's been very hard not to be able to provide the care that we want to. So we know we have a tremendous backlog of surgeries of individuals who have been waiting to receive care and services. So we and our medical staff are very glad that we'll be able to help them again at this time. And we're very grateful to see also that the volumes are increasing in the clinics because that means that people are more confident to reach out. Our telehealth numbers, of course, are very, very stable and strong. And as I think everyone remembers, we didn't even have that a month or more, a little more than a month ago to offer to our patients, and we do now. So many are reaching out via telehealth, which is a very good thing. And we have tried to make telehealth more accessible to people who don't have the ability on their own. They can drive up to the clinic and someone can help them do this from their car. So that's been very helpful also. But we're just very grateful that people are feeling more secure in going to the clinic to see their provider if they need to, because those numbers are increasing again too. So all of this is very good news, and we view all of it very, very positively.
All right, we have a question from Travis Brees with KWWL. Are Mercy doctors continuing to follow up with patients who have recovered from COVID-19 for possible long-term lung complications or increased risk of pneumonia?
We follow up with patients who have been discharged and patients who have tested positive every 3 days. So either our health coaches or our Mercy on Call coaches contact them by phone every 3 days until they have reached that point of being 28 days away from symptoms and so forth, so that we know that they are doing fine. So that's a very, very important element of the care that we provide.
Thanks, Margaret. We don't have any more questions right now, but again, we're going to give it a little bit, a couple seconds to see if we get any more.
Okay, thank you.
All right. Thank you, Margaret.
All right. Thank you, Kelly. Thanks, everybody. Bye-bye.
All right. And now we have Jeff Kalbach, aging specialist with Johnson County Social Services.
Thank you, Kelly. May is Older Americans Month. It's a good time to remind people to check in on their elderly neighbors, family, friends, make sure they're doing well, have necessary food and supplies. Some real easy ways, as you can imagine, to stay in touch with people. You can call, text. If you have the ability to video chat with individuals, that is really awesome, especially with that population that may be more isolated than some of the general public. If you don't have the ability to call them, you don't know their number, if it's a neighbor, you can leave a note on their door, just letting them know about you're there to provide any services, or just send them a nice note. Social media, Nextdoor, Facebook, many older adults are utilizing this technology. You can keep in touch with people that way as well. And even just seeing people outside and just maintaining an appropriate social distance. During this time as well, there's some resources for older adults and other at-risk populations. There's a new group that's running errands for people, for instance. A lot of changes in service delivery for food and meals. Financial assistance potentially for those affected with the COVID-19 pandemic. And even services that still exist, like the Warm Line, where individuals who, not in a mental health emergency, but could use the ability to talk with somebody, may just be, awfully depressed or feeling a little bit down. It's a great service that's available as well. Questions about any of those and, more information about those services, you can just give me a call at the county, 319-688-5842, or they can contact Johnson County Social Services as well, 319-356-6090. Last thing I really wanted to touch on today was just scams. The older adult population is often targeted, and during times of pandemics or current event issues, people like to try and prey upon that population. So a couple of scams that we're hearing about in the state are about relief payments. Hopefully most people have received those, but government agencies do not call you to ask information, so do not provide any personal information about yourself regarding relief payments. Medicare Scams is another one. Scammers might call to offer things like a COVID-19 kit or a coronavirus package, your Medicare benefits related to the virus, but they'll ask you to verify personal information like your bank account, Social Security, or Medicare numbers. So if you get a call like this, just know it's a scam, end the call. You can also report this to the FTC as well. Some basic things just to kind of remember regarding scams. If you don't know the number, don't answer the phone. If you do answer the phone, you don't have to be courteous. You can just say no, hang up. You get text messages or emails with links in them. If you do not know the sender, do not click on those links. Even if you know the sender, just be aware that somebody may have broken into their account, or somehow there could be some information that just came in out of the blue that is not from that sender. Somebody cloned it. So don't click on those links. Just always, for providing personal information, never do that over the phone with people that are calling you, that are not trusted people that you know, or if you make sure that you know that this is somebody that you know as well. Sometimes people can impersonate somebody, maybe using a different phone number. If it's an odd phone number, I'd always just take a second to think about that before providing any personal information. At this time, obviously be cautious of anyone at your door, but always just, if somebody's coming up to your door that you do not know, you may be putting your health and financial wellness at risk for anybody that's trying to sell you something. Don't pay in advance for stimulus money. It does not work that way. You will get your stimulus money. You do not need to make any payments towards it. Do not pay about any information about aid programs or investments or the latest miracle cure that's out there for COVID-19. And be cautious of any investments, particularly those with that are related to the threat of COVID-19. Don't use gift cards for payments. That is kind of a real big red flag as far as it's a scam. If they're requesting that you pay in gift cards, they're untraceable, which then makes it very difficult, and you will not get that money back. If anybody's ever threatening blackmail, stop immediately, alert the police or other officials. Be cautious of investment scams touting guaranteed returns which can be used to pay for rent, food, or other expenses. Last but not least, if you are somebody who's been scammed, don't be embarrassed to report it. It's really important to be able to report these. It's a responsible step in handling your finances, trying to prevent other people from having a similar fate, and hopefully catching the individuals. There is a great resource out there, iowafraudfighters.gov, that can be utilized. It has a lot of great information about recent scams, ways to protect yourselves, and great contact information if you feel like you have been scammed or feel like you may be at risk of being scammed. I'll take any questions that anybody might have.
Okay, this question is from Hillary at the Press Citizen. What are the biggest needs and concerns Aging Services is seeing right now?
I've really been in contact with clients that I've currently been working with over the last several months, and most of the immediate needs were revolved around food. And I think knowing that there's some different service delivery with Meals on Wheels, providing frozen meals and breakfast bags, shelf-stable foods, the pantries doing food delivery now have really taken care of most of those immediate needs that we're seeing. Now that we're 6 weeks into this, it's trying to monitor what things may come up. But at this point, that was the initial situation we were seeing. I haven't been getting a lot of new calls, so I don't know if people aren't aware that this service exists, and that's what we really want to do is just make people aware that if they have any questions or they're having any difficulties right now, that they reach out so that we can make sure that we provide them with a resource.
Okay, this question is from Sarah at the Daily Iowan. How many reports have you received about scams? Is it a significant increase than before the pandemic hit?
I'll just say I don't typically get a lot of reports for scams, so I have not seen any come through directly to me. Most of the time, these are going to go directly to the police or straight to Iowa Fraud Fighters. So I don't know that there's an uptick, but I think there's an uptick certainly in the number of people trying to scam, particularly with the COVID-19 pandemic.
Okay. This question is from Aaron at KCRG. Have you heard from either Iowa City Police Department or the Sheriff's Office about people specifically in Johnson County being scammed? And has that been on the rise here locally?
I think once again, no, I haven't heard that there's a large increase in either calls, particularly to Johnson County residents or people that have been scammed.
So we'll give it just a few seconds to see if we receive any more questions.
All right, thank you.
All right, next up we have Brad Friedoff, Conservation Program Manager for Johnson County Conservation.
Thanks, Kelly, for having us today. I'm here to talk about the impacts of the COVID-19 on our parks, trails, and conservation areas managed by the Johnson County Conservation Board. The Conservation Board and staff understands the disruption and anxiety that this COVID-19 health emergency has created within our communities. As outdoor enthusiasts ourselves, we understand the respite that a park and natural area can provide for our mental health and the recreational and physical exercise they can provide for our body. As COVID-19 spread throughout our community and across the state, it became apparent that parks, trails, and natural areas would play a very important role in the mental health and the physical well-being of our communities. To date, all Johnson County parks, trails, and conservation areas remain open to the public. The playgrounds and campgrounds are the only amenities that have been closed by the order of the governor. To protect the health and well-being of our residents, visitors, volunteers, and staff, we encourage park visitors, trail users, and all other outdoor recreation enthusiasts to practice a few simple recommendations to help us all get through this together. First, if you're feeling ill or have felt ill in the past 2 weeks, please stay home. The parks will be there when you get better. Practice physical distancing. Stay 6 feet or more away from other park visitors. You don't want to give away your favorite fishing hole or morel mushroom spot anyway. Limit group size to less than 10 people. Take photos, share memories, and encourage people to go back to the places you love when you're not there. Share the trails. There's a lot of hikers, bicyclists, runners, dog walkers, all wanting to get outdoors. The weather is going to turn and be beautiful. Not right now, but in the next few days it'll turn and we'll have great weather again. Please try to practice physical distancing from all those people. Alert them when you may be passing them or going around them, and step to one side of the trail and let them do the same. That physical distancing, remember most of our trails are 8 to 10 feet wide, so there's plenty of room for all of us out there. Schedule your visits to parks and recreation areas during off-peak hours. Early mornings are a great time to catch a sunrise, enjoy a cup of coffee by the lake, or simply listen to the birds and frogs singing out there. Pack your sunscreen, insect repellent, and if you aren't already doing it, add hand sanitizer to that list. Frequent hand washing and sanitation will help us slow the spread and keep our communities healthy. And bring your own water. If you're out there with a group, you want to stay hydrated, but you don't want to share your bottle of water with others that may be in your group. And lastly, pack it in and pack it out. If you're coming to the park, remember a trash bag and take home any trash that you may see that you have created. We will be there to pick up the other trash, but please take home any trash that you create when you're out there. If you want to get outdoors and do some of the things I just talked about, but just don't know where to start, visit the Johnson County Conservation Facebook page. Staff have been working hard to create blogs to explain some of our areas and help you explore those areas. We've also been providing posts on a wide variety of outdoor and backyard-based activities for families that encourage outdoor curiosity, inspiration, and awe. There's something out there for everybody on our Facebook page, so check it out today when you have a chance. This community has wisely invested in our natural resources, parks, and trails. So in this time of need, we encourage you all to take advantage of these great opportunities. Staff are working hard to keep our parks clean and ready for your visit, while we all await the days when we can gather around a campfire to share stories, enjoy large family gatherings again, or play on the playgrounds with our kids. Until then, let's get outdoors, practice social distancing, and enjoy the natural resources around us. Please feel free to call our conservation office at 319-645-2315 if you have any questions on the amenities that may or may not be open at that time. And together, we will all get through this as a group. So I will open it up for questions now if anybody has any about our parks or natural areas.
This question is from Hillary at the Press Citizen. Are Johnson County parks seeing a surge in visitors?
We are seeing heavy use, but we are also witnessing that people are spreading out. Remember, these parks are large places, 1,000 acres sometimes. So as long as people are practicing that physical distancing, leaving 6 feet between other visitors, staying with your family group, and we are witnessing that, then we're going to be fine visiting our parks and recreation areas.
So another question from Hillary. If people are seen not practicing social distancing or have gatherings of more than 10 people in parks, will there be some kind of enforcement? Yeah,
so our staff is out there working daily, whether it's doing maintenance in our woodland units or prairies or doing regular enforcement actions around the park. We are, at this time, we're not ticketing or citing anybody, but we are giving them information about why physical distancing is important, and talking about the COVID-19 incident and why their gathering is not a good thing for this incident.
A question from Sarah at the Daily Iowan. Would Johnson County consider closing the parks if people do not follow these guidelines?
At this time, we haven't seen any instance of that. We really find that a lot of our medical people are firsthand caregivers, right? We look at ourselves as preventative medicine. We all need to have that mental break, need to have that recreational opportunity, that exercise opportunity. So we would consider it if things get bad enough, but we would base that upon the guidance of public health department or state leaders. At this time, we have no indication that we would ever do that.
Okay, also from Sarah. How can Johnson County ensure people are social distancing while in parks? Will there be police supervision in popular parks to disperse large groups?
Again, as we stated before, we are seeing people practicing social distancing. And again, this becomes the responsibility of our visitors. If you feel like your space is being encroached upon, we ask you to politely go to a different spot of the park, visit somewhere else. So far, we haven't had any of those problems, and people are being very polite and respectful, getting out there, utilizing the trail. We're all in this together, as I've stated, and we want to make sure that we can all continue to enjoy these. And at this time, we have seen no indications that anybody is going against those guidelines.
Okay, this question is from Aaron at KCRG. Has Johnson County Conservation heard from anyone regarding concerns from people not social distancing, considering the increase in people wanting to get out?
We have not. At the time and place when we are able to open campgrounds and do those things again, there may be things that we do to encourage social distancing within those facilities. But right now, it's guidelines. Being here today and asking the residents of Johnson County to take the time to spread out on our trails, utilize those resources at different times, and do things to help us slow this spread, to help our public health partners to get through this. That's what we're all about. And we think parks, trails, and natural areas are very important to people for their physical and mental well-being. And so we're going to do everything we can to communicate with the public that physical distancing is very important, and I think they're heeding that advice.
Okay, follow up from Aaron. What does enforcement look like if necessary, and at what point is enforcement necessary over education?
We haven't got to that point, and I think it's just going to be just like anywhere else. People are very wise, and they understand why social distancing physical distancing is very important. Again, I can't guess what may happen in the future, but we haven't had any of those cases. When we do have groups that gather, they do it very quickly, and when we approach and ask them to disperse, they're more than happy, and they understand why. We do have people becoming very creative. Sometimes it looks like tailgates going on, where you'll have one group of people over here, and 10 to 15 feet away is another group of people, and they're communicating, and they're enjoying the outdoors together, but they're not socially close together. And so that's what we encourage. If you come in two different carloads, as long as you're not having participating in contact activities, go out there, go for a hike, share those experiences. Again, we encourage you to share memories, share photos, use social media to share your experiences. But if you are out there at the same time, again, it comes back to those simple guidelines we ask. Provide that physical distance, sanitize your hands, follow all the guidelines that all the other agencies that have been up here have talked about, and that's going to help us get through all of this.
Okay, we don't have any questions at this time, and we'll just give it a minute.
All right, thank you. Get outdoors, but remember, physical distance.
Thank you, Brad. And to wrap things up, we have Sam Jarvis, Community Health Manager with Johnson County Public Health.
Thanks, Kelly. Good afternoon. Thank you for joining us today. For numbers for Johnson County, to date, we've reported 505 confirmed cases, with 277 of those resolving. But today we wanted to take the time to explain the difference between physical distancing and social distancing. As some of you may have been aware or seen, there's been a change in the way we and others are telling people to be safe. We want to explain that physical distancing, which is staying at least 6 feet apart, is what we want people to continue to do while you socially interact. When you physically distance yourself, you're creating a space between you and others when you're at home or running essential errands. But why are we bringing this up now? The emotional toll that social isolation can bring is also dangerous. And it's important that we continue to support one another and to maintain healthy social lives, just 6 feet apart. We'd prefer a call or video chat from home, but if you are around others, you can still say hello. You can carry on a conversation from 6 feet apart, and even though we're asking people to not shake hands, you can still wave. Now, having said that, with physical distancing and other safety measures in place, Mother's Day may look quite different for some of us. That doesn't mean we should be any less grateful or appreciative or show any less appreciation, but we're advising everyone to take every precaution necessary to keep our loved ones safe. We are still advising everyone to stay home if they're ill and to avoid physically visiting others if they're ill and avoiding non-essential travel. But if you do visit, please remember to take all other precautions that you can to help keep yourself and others safe. Cover your cough and sneezes, wash your hands frequently, and if you cannot maintain physical distance, please wear a face covering or mask. Thank you. And with that, I'll take any questions.
Okay, this question is from Sarah at the Daily Iowan. How is the county ensuring that people are continuing to social distance and limit gatherings, especially as the weather outside continues to warm up?
That's a great concern. We continue to work with our partners. Like today, we had several of our other county agencies take part in this. And we continue to coordinate with our partners to get out messaging to their populations that they work with, to their stakeholders, to continue that messaging. We know that's going to be more and more difficult as it gets warmer. So we thank everyone for being patient. We thank everyone for continuing to do all of this hard work. It's hard for us too. So please continue to do so, and thank you for doing your best.
Okay, there are no questions at this time. We'll just give it a minute. Okay, this question is from Hillary, the Press Citizen. Can you talk about the county's contact tracing program? For example, how many specialists are now working on cases in the county?
Yeah, absolutely. So initially and early on, we began to rapidly expand what our disease investigation team was. Originally, Johnson County Public Health has 2 disease prevention specialists. We've moved to 4 with other support staff helping with that effort. As we continue to look at what our future may hold, we are looking at what our contact tracing program will look like and being able to expand that. So certainly more to come on that. But right now we are roughly at 7 staff supporting that role right now. So.
Okay, another question from Hillary. Just over a week ago on April 26th, there were 437 positive cases in the county. As of May 4th, the state's health department reported there were 518 in the county. Can the department talk about how cases continue spreading locally?
Yeah, absolutely. So, throughout this time, and I'm kind of thinking back at the time frame that you just reported, we've seen a continued steady amount of cases that come in, anywhere between 6 to 10 a day. And so we're still seeing it in our community. We're still seeing that come in at a steady rate. So by no means are we seeing a downturn at all, but certainly not any dramatic increases.
Okay, question from Travis at KWWL. Iowa Department of Public Health is reporting 518 cases in Johnson County as of 10 a.m. yesterday morning. How is this possible, and how do you interact with them on case counts?
So a lot of the numbers that were being reported are coming through their disease surveillance system. And so what you might be seeing right there on their site is potentially a lag from when they're reporting. They've got a specific cutoff time that they're reporting. We're getting cases in throughout the day and even into the evening, so our numbers may differ. So.
Okay, and we'll just give it a minute to see if there are any other questions that come through.
All right, thank you.
Thank you, Sam. That concludes our press conference. Once again, thank you to everyone who participated, our community partners, our members of the media, and for those who are watching live. We will see you again soon virtually.